Alrighty. Alrighty. Good evening, everyone. Good morning, good afternoon from wherever you are catching this week's session from, and in case you're catching this as a recording. My name is Noeline Mumbi. I am the host of Safe Space. Safe Space is a judgment-free learning zone. Think of it as your free mentorship platform where we all gather to learn, gather to ask questions, and just to know more. So today I am joined by the team from Chiropractic and Physiotherapy Health Center. Just to give a bit of background, and I'd posted some of this on my LinkedIn today morning. I have personal experience with CP. I call them CP. Their full name is Chiropractic and Physiotherapy Health Center. Having been a patient of theirs, and you can catch this on my post from today morning, they are here to teach us on ergonomics. If your back is hurting, your chest is hurting, you have a limp, your muscles are aching, and you have no idea what's going on, and you're actually thinking of going to the spa instead of visiting a physiotherapist, this is your session. Share with your friends, let guys know that this is going on so they can join us. I'll jump right into it. So, welcome, Dr. Dion, and welcome, Dr. Petty. You are on mute, my dear.
I'm muted.
Now
Okay.
you are not.
Okay.
Good
Thank you very
evening.
much. Good evening to you, Mombi. My
Thank you
name
for
is Loves.
Go on. Sorry for cutting you short.
Thank you for inviting us for this meeting. And I hope by the end it will be a good report and be profitable to your clients.
Thank you. Thank you so much for even making the time to join us this evening. So
Yes.
I'll go right into introducing you. Sorry about that. Introducing you to the audience. So Dr. Dion Jogu, Dion's physiotherapy career began in 1982. Her journey began in Kenyatta Hospital and after 8 years moved to Nairobi Hospital for a few months and then settled in Mater Hospital. Here, she played various roles, including head of department for 15 years, before venturing out on her own. She helped establish physiotherapy departments in Equator Hospital, as well as Family Health Options Kenya. She has been in private practice since 2005. Having worked with numerous doctors and different medical specialists, in 2008 she partnered with a chiropractor. Later, she began Chiropractic and Physiotherapy Health Center Limited. Today, the center has three branches: Karen, Westlands, and Ridgeways. Today, apart from treatment, she trains physiotherapists, holds spine checkups, camps, and ergonomic assessments, and gives health talks, as she's doing this evening. Some of the clients include Serena Hotel, Safaricom Limited, Unilever Tea, ICDC, BAT, Bayer East Africa, EABL, and Zamara, just to mention a few of the clients and the stakeholders that she has collaborated with. Thank you so much for joining us this evening, Dr. Dion.
Welcome.
Next, I'm going to introduce Dr. Peteka Inangobeni. Good evening, Dr.
Good evening.
I'll go ahead and introduce you. Patty graduated not only with a Bachelor of Health Sciences in Chiropractic, but also a master's degree in chiropractic medicine at University of Johannesburg, South Africa. She is a member of the Allied Health Professions of South Africa. She has been in private practice in Pretoria, South Africa for over 5 years before joining Chiropractic and Physiotherapy Health Center in 2023. Not only is Dr. Petty proficient in chiropractic adjustments, but kinesio tapping and dry needling, IMS as well. Having worked with numerous doctors of chiropractic and other medical specialists in the past, Dr. Petty carries out extensive education to members of the public on spine health. Some of the clients include Health Inside, Nairobi Academy, Vet Lab Sports Club, among others. Thank you so much for joining us this evening, Dr. Petty.
Thank you.
Without further ado, I will hand it over to your team. We are here to learn about our backs. Those of us who have back issues, by the way, we are here to learn. Over to you, Daktari.
Thank you. And we want to start by introducing the spine. Because when people have backache, they just say, I'm having backache. But apart from the hand and the lower limbs, everybody calls the whole area from the neck to the lower limbs, calls it the back. So our spine, where our nerves originate from, is divided into 5 sections, and it is what we call vertebral column. This is where our nerves are introduced to the muscles and the limbs we usually use. There is the neck, which we call in medical cervical. We have the thoracic, which people call the chest. We have lumbar, which is the lower part of your back most of the people complain of, and where the vertebral column sits called the sacrum, and the end of it is called the coccyx. To be able to understand this situation, it's good to take just a section of the vertebral column so that you can see what it involves within that place, so that you can understand when you're having a backache or neck ache, what could be the problem with you. The spinal cord, which carries the nerves or the cells where the nerves come from, is the one in the middle of the spinal column. In between it is what we call the vertebra. So the cord goes through the vertebral body, which has its own wings, like what we call facet joint. We have the nerves now protruding out of the spinal cord. We call them spinal nerves. Between one bone, that is vertebra, and the other vertebra, there's something we call intervertebral disc. If any sprain or any interference on the spinal column, the soldier here is the intervertebral disc. It is the one which protects the nerve and the cord from being injured. Now with that, which everybody can be able to read, we can be able to go to the next session. What causes back pain? Most common causes of back pain are, or musculoskeletal, as we call it, disorders, is these 6 issues. Either whatever it is, whatever back you have, unless it is an accident, most of the things which cause us to have day-to-day low back pain or mid back pain are the following. And this is from our research we have done with the most big companies to find out why people are having back pains. The first one is how we sit and how long we sit. The second one is how we stand and how long we stand. How we lift and how we carry objects. Being overweight or obese, use of inappropriate shoes, and how we sleep. Now, in this in mind, we shall go through one by one, then we will understand what all this means. You can see the 2 people in front of you seated. If I asked you who is sitting better, you will tell me it is the person on your right. Seriously, I would say none of them is sitting well, but from the face of you, that is the wrong ergonomic sitting. Let's go to what is the proper sitting position. When sitting, the most important thing is that wherever you are, either it is a desk or it is your dining table, always make sure your forearms are never resting on the top of the table. It should be only the wrist, which is on your table. We will take this example as somebody in the office having the computer and a seat where they are working from. As you can see with the first number one is the wrist. The wrist and the fingers are only part of your arms, which are around on the table. This will allow your back blades, which we call the shoulder blades, to be positioned in a neutral position. Because if you go forward than that, you stretch the muscles of your upper back, and that way they become weak that you can't hold yourself back. And lastly, you say you are feeling pain between your shoulder blades. Number two is our feet. Most of us put their feet on the floor, and that way what happens, the area I called the pelvis or the sacrum on the picture I showed you tilts backwards, and that way it makes the whole spine change its posture. To be able to maintain the posture of your spinal column is usually to have a footrest under your table. You can always put both feet up, or you put alternatively. That way you maintain your sacrum in a normal position, and your vertebral column will be sitting properly where it should be able to work properly. That is number two. The feet must be always up, like 6 inches from the ground. That way you maintain the posture of the spine. The third one is the seat you are sitting on. You should move so much back of your chair such that the bottoms are on the chair edge. And then your upper back is resting on the chair rest, upper back. That way you'll find that since your legs are already up, you'll find that you relax the whole body, the muscles of the legs and of the upper back, such that you can work in a very good comfort. The other one is the eyes. The eyes where you are facing. Let's not let the eyes look down. When you look down, you affect your neck, and the neck in the process will start hurting. So always the eyes should be in the same level almost with the ears, looking in front of you. So if it is a screen, you must make it at least up such that the eyes are straight to the screen. If it is a laptop, lift the laptop up to the level of your eyes. And the last one is the screen where you are. Most of the people pull their screens to next to them, like 1 foot from where you are. The distance between you and the screen should be your arm length. Most of the arm length is 1.5 foot of your distance. So if you want to know whether the screen is near you or it is on the proper place, excuse me, is that you put your arm until the middle finger is touching the screen while you are sitting in the proper position we talked about. If it is too near, you push it away until you find that distance, or if it is too far, you bring it nearer you so that the distance is completely 1.5 feet. If you don't want to do that, measure the distance with a tape measure so that you are able to bring it to 1.5 feet. The next one is what we call ergonomics on laptop. You can see you have a laser. All the other facilities is the same. You have to have a footrest. Your whole back should be supported from the bottom of your back. The arms should be resting, or they shouldn't be resting on your table. The other sitting is when you are driving. You can see a very good picture there to tell you, you always bend your arms slightly and your knees slightly so that you pull your seat towards you so that you are upright and the back and the neck are all straight. That way you won't feel any pressure even if you drive for a very long time. But if you bring the chair too near the driving wheel, you'll find that you'll always have pain on your thighs, that is towards your hips. That way it is because you are shortening the muscle and it is always in a short position when you are driving. If you put it too far, you'll find that your lower back will be always twisting and causing pain on your lower back. So it should be the way we have shown it here. Try your best and then you do a good posture. The other thing we are going to talk about is the standing. How do we stand? Most of people will stand like the first picture we have seen on your left, and it is not a joke. If you look at your colleagues when you are out for a drink or anything, that is the position most of us take because you relax the whole body, the stomach, the lower back, the legs, such that you'll become like if you are just sagging yourself. The best position is always the second one, which is on your right. This one you should be always feeling like a string on your head, pulling you up towards heaven. Or there's a line between you and the chest down to the feet. That makes you feel very, very upright. That is the correct way of standing. So, how do we know that we are standing properly? The first thing is to take a deep breath and feel taller than your height. When you do that, your tummy or stomach muscles will be always tucked in towards the spine. And that way, they support the spine the way it should be, but not sagging to the front. That way, you exercise the muscles of the tummy and the back at the same time. And then, when you are feeling taller than your height, your breathing becomes very easy and you get the lungs expanding properly. So, there is enough oxygen for all of it of your body. Yeah. Those are standing postures. And you can see the best is the last one, which is a good posture. That is the line of gravity is coming from the hand or down to the ankles. So you see the ear, the shoulder, the elbow, the hip, the knee are all in one line. That is the proper way of standing. So due to poor ergonomics, you find us acquiring all these other postures, which is like thoracic, kyphosis, forward head, lumbar lordosis are all acquired because we are not aware of how we should be standing. So if you see anybody with such a posture, you know very well they are not standing well. And always your tummy tucked in. That maintains our spinal column. If you have to work standing, the first thing, as we said, is to make a footrest in front of you. That is one leg front and the other one back, but they are stepping on 6 inches footrest. Yeah. The fingers and the wrist are the only ones around to be on the working table. Arm length is the distance required between you and your screen. If it comes near you, you'll hurt both your neck and your upper back. If it is too far from you, you'll hurt your lower back. So the best thing is to look at that picture and you can see the position you need to take. When you are turned with the right leg, you change your legs. The left now goes up, the right goes down. And that way, by the end of the day, you won't have any fatigue. Lifting and carrying objects. Maybe this picture might not really explain what you mean by proper lifting and proper carrying. I will describe it. If you have a baby who is a toddler, maybe walking around like 3, 4, 5 years, and you want to hug them and carry them up, the best thing is you to squat to their height. Let them hug you. You hug them together. Then use your strong muscles of the legs to come up with the child. That way, her weight or his weight will be along with your own weight. So you won't feel this weight on your back. But if you stretch your arms to pick the child, what will happen is that the weight of your child will be going directly to your spinal column. And that way, most of us sprain the back because they lifted the weight away from you. So, whatever weight you carry, even if it is a bag of salt, sand, or sugar, it must be next to you so that there is no way you are going to use the weak muscles of our vertebral column. God gave us very strong muscles of our limbs. If you look at the thigh muscles are very strong, and they are the ones which we are supposed to use for lifting. Then for the arms, they are the ones for holding. So always whatever subject you are carrying or object, make sure it is next to your body, not away from your body. When you go to drop it somewhere else, you make sure you are next to that place so that you keep it easily without using your back. So whenever you are lifting, carrying, use your lower limb muscles. The other one we talked about is overweight. This picture really is very self-explanatory. If you look at the gentleman who is very lean, as people we are calling him lean people, the neck is good and good curvature. The thoracics are very good. The lumbar is positioned the right way. When they stand, the pelvis is well carrying your vertebral column in standing position. Otherwise, it is best, and you can see always they look forward. When you go to somebody who has added too much weight, and when we say this is that there is a way of weighing yourself so that we allow 10% of your body weight only. If you go beyond 10% of your normal weight, you will always be in a obese situation. How do you do this? You can see a nutritionist, they will advise you. But always make sure your normal weight, because we have to eat and enjoy our life, can go up with 10%. Like now, if you are 50 kilos, you can hand 5 kilos on top. It won't affect you, and you don't look obese or overweight. So when you get over obesity, what happens? The neck muscles get too fat and the neck goes inside. You curve your chest such that it is rounded, which is very funny. You'll find the center of gravity of your body shifts backwards, forcing you to be always walking with the knees bent. The curvature in the back gets lost and you get this type of posture. So you can see the person who is lean, the spinal column is very straight. When you put on weight, you get an exaggerated curvature on your lower back, thus deforming your vertebral column. And at the same time, the nerves which come out from there, they will be always pressed. Then you will find the center of gravity goes straight to your stomach in front, and it is out of the way of your body. Due to that, you can't walk with your knees well properly because you will have to bend your knees when walking so that you do like if you are stooping for you to feel comfortable to walk. So that is the dangerous part when you do have overweight. Yeah, we go to the next one, which is sleeping positions. Sleeping positions, what we say is always use a comfortable area where you don't find it is too firm because it will bruise you or too soft to sag you. So the right firmness of your body is when if you get a mattress or the place you are sleeping on, put your hand or your thumb and press the mattress or the sleeping area. If you find it is going more than 1 inch, that is a soft area. If it goes less than a centimeter, it is too firm. So the best one is when it goes 1 inch, and that way it is maintained. That is the right firmness for you to sleep on, because it will take the contours of your body and the spine will be always maintained and gives you a natural spinal alignment and good circulation of blood and nerve supply. Sleeping positions. This one, I know there is so much change with people talking about it. The best position to sleep in is the two positions we have shown you here. You can sleep on your side or sleep on your back. When you sleep on your side, always make sure that you don't sleep on your arm, because when you sleep on your arm, you wake up feeling numb on that arm. The other thing is you can put a pillow between your thighs or knees so that the hips and the pelvis, which we call sacrum, they are always in alignment. That is the best way to sleep. So long as you use the best and good pillow, because if you don't have good pillow, you will end up using your arm as a pillow, and that will not make you sleep comfortably. The other one is when you sleep on your back. Always, whenever you sleep on your back, you have to put 2 or 3 pillows under your knees so that the sacrum, which we call the pelvis, is being able to tilt on the floor so that it doesn't make you and put too much pressure on your column, which will be always lifted up. But when they are bent and it is lying on your couch or on your bed, it will make you very comfortable. So not only one pillow under your knees, mostly 2 or 3 are the best. And that way you can be able to sleep without much effort. The same case with the pillow. It shouldn't be too big because if you put it under your head, it will curve your neck. And in the process, you will not be sleeping well because you will be almost blocking airway when you are sleeping. So the best thing is to use a good orthopedic pillow for your neck when you are sleeping, either on the side or on your back. Use of pillows, that is what I've been talking about. If you use a very hard pillow, it will curve your spine column, and you will find that when you are sleeping, the airway is almost blocked. So the best thing is to make sure you have where the pillow allows the neck to be straight and the head is resting in part of the pillow, which is the second picture you can see there. That is what we call orthopedic pillow. Despite our life and talking about ergonomics, we find that we have some common bad habits we do. Being a human being is always when you are talking with your phone, you put it on the side. When you do that the whole day, by tomorrow you'll be having neck pain just because of using the phone poorly. So whenever you want to use your phone, use a speaker or use headphones or earphones, which will help you to detain the natural curvature of your neck without involving one side of the muscles while the others are relaxing. So let's avoid that habit. The other one is texting. We call it texting neck. Most of people, especially when we started using these phones, they used to feel a lot of come back to us with a lot of pain on the neck and on what we call the thoracic. So the best way is to always put your phone in front of you to avoid bedding and to avoid muscle strain on your neck. The one now we are going to do is what we call use of inappropriate shoes. Really, when we talk about high heels, it doesn't mean they are bad shoes. It is the effect they have on you when they are used for too long. If you are using them for an hour or two, it's okay. But if you have to use high-heeled shoes for the whole day, you will get the posture we can see on your right. First of all, you get excessive curvature on your spinal column, which tells you are stretching your nerves. And they can start making you feel numbness or not feeling properly on your lower limbs. If you look at the neck, it has to be even longer than where it is because the chest has to go forward so as to allow the neck to be moved backwards. So here you put 2 strains on yourself. That is excessive curvature on your back. The chest in forward, automatically you have changed your shape, and that way you go always in attention. You are so tensed to maintain that posture. For you to stand that way, you have to make sure that the knee is either slightly bent or even you are bending knees when you are walking, which is putting excessive pressure on your legs. The other thing, because of the high heeled, you'll find the whole weight of your body goes to the toes and the other one goes to the heels. So that when you remove them, the calf muscles are so shortened, lastly, you won't be able to be putting your foot on the floor. The curvature, and it makes the tendons of the back of your foot to be so tight, such that it is another reason for you to go and see a specialist to make the calf a bit tight. This way, with that curvature excess on your back, it makes your gluteal muscles so tight, such that when you start walking, you hope instead of pulling your leg forward. And that is a posture we don't want for you. Otherwise, when you stand straight, you can see how the gravity is on your body. This explains very well what happens when you wear high shoes. The pressure concentrates on your calf and it makes the calf very tight. So when you step down, it becomes very difficult to put the whole foot on the floor. So let's try to be always using it moderately. Despite that it's tight, it is also weak, which makes you not be able to study for long. The other shoes is very flat shoes. When we use very flat shoes, we are putting all our body weight on our heel. And this is when people come later with something we call plantar fascia. This is excessive weight on the heel, and then the muscles become weak all the way to the toes. So you find that when you put the flat shoes, even your foot becomes wider, which means there is no support, which we call the arch on your foot. So you lose the arch due to the very, very flat shoes. Excessive tension, weakness of the muscles. When you walk with it, you start feeling pain on your heel every morning when you wake up. So let's not use so flat shoes. If you have to use a shoe, let's have a slightly higher, at least 1 inch high from the bottom of your toes. That way, it keeps the muscles of the foot strong, and they will not be able to support you due to a curve on the arch. So how do we know whether the arch is good or the foot is being too wide or too high for our own lives? We call this, there is either a pronation or a supination of your foot to be able to understand your foot. When we say supination is where the foot turns inwards. So like if they are facing one another. So when they face one another, you put too much pressure on your ankle joints, and in the process, you start feeling what we have called plantar fasciitis. So you have a very high arch, and it causes a lot of discomfort in our foot. The last one, which is overpronation, is that you walk like if your feet are facing away from your ankle joints, which causes now to drop the arch, and it becomes a flat foot. I'm sure so many of you have had it or seen people with the flat feet. If you look at it from now, the picture on your right, number one is at least a natural foot. If you step on a soil and see that, be happy it is a neutral, well-formed arch. If it is too high, it is what we call supination, which means you are stepping only with the front of your foot and behind. And the last one is flat one. The flat one, you can be able to say some people are born with it, but it can be corrected. Yeah? But if you acquire it, please, you have to get medical intervention to avoid so much. Anybody with a flat foot will be always having a back problem. Everybody with a very high arch will always have a back problem. So if you have the two, be checked to check how your back is, because lastly, you will come with the muscles which are so tensed, and the joints which are joining the vertebra, and the sacrum will be always overworked due to excessive pressure. This is the way you can be able to look at yourself. If you go towards a mirror and we start to look at you, if you are balanced, it will always tell you the shoulders are equal, the pelvis is sitting properly, the knees are in alignment, and the feet are facing properly. If you are not balanced, you will find that one shoulder is always higher than the other. You have to stand with one side bent so that to balance yourself. When you stand with one knee bent, the problem is that you will have a dropped foot, which we call an arch. It will be dropped, and this one will cause very severe discomfort on our vertebral body. Yeah, which causes the muscles also to be in a bad shape. So let's always try to balance ourselves on the right side. This is another habit which now I can say most of people have changed. They have learned carrying anything on the shoulder or carrying on the hand, swinging it. It always will affect your spine. The best thing is to carry on the right. The other one habit is crossing our legs when seated. This is a habit everybody thought it is the best position to sit in. But when you cross your legs, you are tilting your sacrum such that you are twisting your spine. which is also going to affect the muscles and the nerves of the one side. This is the way it looks. When you sit down properly, it is that way. But when you are sitting badly, this is what will happen. It's also unfortunate for men because they put their wallets on the back pocket. That is what happens. The way the shirt is creased is the way our muscles are creased and the nerves are squeezed. So avoid it to sit cross-legged because it will cause you a lot of pain, discomfort, and tension with your body. So common effects of poor posture: always you tighten your jaw, always the neck and is very tight and you always feel back pain. Hip, knees, and foot pain occasionally. Shoulder pains are like day to day, and feeling always tired and breathing issues make you feel as if you are having heart problem. This picture was taken for a gentleman who came from school with very good grades and was employed by a company. When he sat down to do the work, whichever he was given, he worked so hard such that he started having back pain, starting with the upper back. What happened when we took the photo, we showed him what is happening. You can see he's lost his posture by having the shoulders not in the same level. The tummy or the trunk is shifted to one side, and one hip is higher than the other. This is what happens when you don't take position of sitting properly. So with ergonomics, you sit all the time in a good way, standing always in a good way, and you walk even in a good way. You will always have a good body. Otherwise, you will end up being twisted like this young gentleman. This is our common areas where you find pain. Whenever you have pain on these areas, please come and see us or see anybody. But doctors will give you medicine, but if you come to a physical therapist, they will take care of that position because it is more physical. It is not internal. Yeah, that way, let's hold and hand over to my colleague, the chiropractor.
Good evening, everyone. I hope you are well. Today, I'm going to be giving you a bit of knowledge about what we call misalignments, which is what we deal with as chiropractors. What is a misalignment? A misalignment is when a vertebra on top of the other is not moving well and it's not moving in accordance to the vertebra below. So that causes a lot of inflammation and it causes the nerves to get compressed or pinched, right? And this also can cause muscles to tighten or have spasm. So most of the time when there is a misalignment, there's most likely also some nerve inflammation and some swollen disc, and then you have back pain, right? So when you come see a chiropractor, possibly most of the time, you would have had these causes of misalignment, possibly poor posture. So if you are sitting all day at work and your posture is bad, chances are you are having some misalignments. And trauma like a fall, motor vehicle accident or injury, unexpected sudden movement, lifting improperly, lifting heavy objects improperly, like we have seen earlier with Dr. Dion, how to lift properly. So if you are lifting improperly, you'd have some misalignments happening there due to the improper lifting. So it's very important to lift properly. Chronic pain, sometimes if you've had pain for a long time, you kind of change the way that you present yourself because you're trying to avoid pain. So if it's been there for a long time, you find that you are compensating in order to stay away from pain. Improper rehabilitation. So if you've had some fall or an accident, and then all you did was maybe sleep and rest, and you never got some rehabilitation of those muscles, joints, and nerves, sometimes can lead to chronic issues and misalignment. So now when you have a misalignment, what are the effects? So it will limit your mobility, meaning that you won't be as mobile as you used to be, and you lose your flexibility because you're trying to avoid pain and inflammation in those areas that are misaligned. And pain is another thing that happens when you have a misalignment. So you find that you are constantly feeling like there is pain, either dull aching pain or sometimes even sharp pain that is indicating that there might be a misalignment, especially on your spine. And then another thing that happens there, you'd find that you have muscle spasm, feeling tightness, feeling like there's something that needs to move, but it isn't, and always trying to stretch simply because there could be a misalignment. Another thing that happens is when there's lack of movement, there's lack of circulation, it can cause inflammation, meaning some swelling can happen due to lack of movement or due to a misalignment. So it can also cause lack of rest, and then can also cause fatigue. Remember, now the body is trying to compensate for the joint that's not moving so well. So what is chiropractic, and where do we come in when we're talking about this misalignment? A chiropractic is a healthcare professional who focuses on the spine and other joints of the body and their connection to the nervous system. So now the word chiropractic means it's done by hands. Chiropractors use adjustments to restore joint function and to support the nervous system. They help patients to maintain optimal health while avoiding unnecessary drugs and surgery. Now, let's talk about the role of chiropractic. Firstly, there is what we call the cycle of pain. So once pain starts, muscles start to guard and to try to protect the area that has pain. So once the muscles start guarding or spasming, they restrict mobility. So meaning if you have pain in a certain joint, the muscles around that joint will start spasming, and then you won't be able to move that joint. After some time, that muscle becomes weak and it starts to reduce, and it's now functioning with less power, and you're getting fatigue, and now you have decreased function of that particular joint. So now I'm sure you've experienced that when you've had back pain for quite some time, it tends to stress you because there are some things you cannot do anymore that you used to do. You cannot function in the way that you used to, and that can cause a lot of stress, which, by the way, increases the pain. So it's very important that we remove the source of pain, which can be a misalignment that has happened. And then this will help to facilitate muscle relaxation and balance. This will restore functioning of the muscle groups. So now when the joint is now moving better, it helps the muscles to function better, and then now you have a better range of motion. So if you were not able to reach your toes, now you are able to reach your toes because now the misalignment has been removed. And now when you are able to move more, you have less stress. So these are factors that are contributing to a misalignment and the cycle of pain. Now, maybe you may be asking yourself, I sometimes do this adjusting for myself. I crack my neck and I hear this nice noise that makes me feel a bit of relief, right? And you're asking yourself, is this healthy? Because it feels good. It feels like you're getting some stretch done. So now, what is cracking of the joint? So basically, pressure builds up due to lack of movement. Like you'd be sitting there for long hours in front of your desk and your computer, and because there's been less movement, you feel like you need to move your neck a certain way. Obviously, that provides temporary relief because it doesn't deal with the actual joints that are causing the issue. Most of the time, the neck will actually move all the other joints, which you will feel that cracking sound, except the one that actually has a problem. And then you feel like you have some relief, and then within the next few minutes you do it again, and most of the time it happens as a habit. So it creates a lot of imbalance in terms of which joints are mobile and which ones become hypermobile. So you'd find one area is very stiff and locked whilst the other area is very hypermobile. So, how do we treat these? And what is a chiropractic adjustment? Now, an adjustment puts a force where it's actually needed. So, you might find that you're cracking your neck, but moving just any joint. When we come into chiropractic, we first investigate which joints are actually misaligned, and then we go to that particular joint and give it an adjustment which moves that joint in a way that it should be moving, which will help to align all the other joints. Now, another thing that we mentioned is that it also helps with nerve function. So, as you saw earlier, as Dr. Dion was explaining, that out of your vertebral columns, there comes out nerves. So these nerves are going to certain parts of the body. So if these nerves are hyperstimulated or inflamed, like we saw in a misalignment, they may cause issues as they go and innervate or supply these parts of the body. So as you can see there, they've written innervation. You'll see that some nerves like C1 goes to the eyes, and some nerves go to the lacrimal gland, parotid gland. So those are glands that you find around your eyes and also around your face, the scalp, all of these, and the neck muscles. And you'll find that when those nerves are interrupted or irritated, they will cause all these other problems that you see, possible symptoms like headaches, migraines, dizziness. So you might find that a whole lot of problems that people are having with migraines might be coming from misalignments that have been staying there for very long and have not been treated. You've only just been taking medication. So we're going to talk about one of the issues that we deal with in terms of your back or your spine. It's called cervical radiculopathy, where you would have neck pain, especially at the base of your neck, going down to the shoulder and going into the arm. Now, if there's nerve irritation, that nerve is going to feel pain, and or feel that irritation, and that irritation is going to go along the line where it's supplying. So most of the nerves that are at the base of the neck are supplying the arm. And then as you can see there in the picture, the nerves that become irritated at the base of the neck, so you'd feel like you have pain at the base of the neck, but you'd also feel like it's going into the arm, is because those nerves that are there are now overshooting simply because of that inflammation and because of the misalignments in the neck. Same as for lower back. As you can see, it supplies so many things in your vital organs, and you'd find that many of the problems that we tend to be having can be due to misalignment in the spine, simply because those nerves are now being irritated from their root. So such things can also cause what we call sciatica, which is a nerve inflammation from the nerve root. So now all these nerves that are coming from the lower back and are going into the foot or into the leg, when they are overly stimulated or inflamed or irritated, they will take the pain to go down that same leg. And you'd find someone coming and saying they have back pain, but they feel like it's shooting right into the leg, and sometimes it even ends up at the big toe. So that's showing that there is some nerve irritation that is happening at your lumbar spine. So it's very important to make sure that you are knowledgeable about these things and you are able to get help. And now, if these pains and this irritation and the misalignment are kept for long, and the cycle of pain keeps going round and round, you end up with so much pain because now there are now structural changes that are formulating. The disc is now herniated or desiccated, and this is what they find when they look at your x-rays and your MRI. Now, because there's been so much hypermobility and hypomobility that has lasted for long, they might have to go in there and now start to intervene and stabilize those segments and try to make sure that they don't move, which is another thing that over time tends to exacerbate the pain. So, what are the common benefits of having chiropractic care? So, chiropractic care not only helps with pain, but it increases energy simply because now the nerves are freer and are able to now be regulated properly because you are now moving better and your nerves are not hyperly stimulated. Because your nerves are working well, there's fewer need for hospital admissions. So, like we say, it's prevention is better than cure. There's a decreased need for surgery, and simply because you are taking care of yourself and there's movement in there, and prevention through education, which is a very important aspect. When you know better, you do better. And when you have better posture now, you have good spinal flexibility and a much more restful sleep, and improved mobility and natural pain relief. So those are the benefits of getting some chiropractic care and making sure that your spine is well taken care of and you are preventing some big pains. So, what are the behavioral changes that are needed in order to take better care of your spine? First of all, exercise is very important. Stretching is very important. You have to have at least 3 days, 30 minutes of exercise is very important to keep your spine moving, because the spine has so many joints and they are created so that we can keep moving. So a lot of us tend to have jobs that need us to stay behind the computer and sit for long periods of time. So it's very important that when you get a chance, you go out there, you exercise, you move your body as much as possible. This will increase blood circulation to your brain, to your muscles, to your joints, everywhere. And take breaks to relieve your spine. When you are sitting down, the spine is doing most of the work in maintaining and creating a posture for you. So those muscles, those joints are working very hard. At the same time, you are not realizing that. So it's very important to take some breaks, walk outside, allow your spine to move. Uh, Obviously, another thing is to take tea while standing, allowing yourself to be in a different position. Uh, Keep proper posture and use orthopedic supports. That's very important to have proper posture, as we saw earlier, how to sit, how to sleep, how to pick up things, how to walk, and how to stand. uh, Seeking treatment and rehabilitation when necessary. It's very important that you do not wait until the pain is unbearable. You must take that step of getting treatment when you feel pain. You can also have spine checkups at least twice a year, where you are coming in for a spine screening and you are actually being proactive about taking care of your spine. And then obviously, it's very important to keep mentally and emotionally fit. Um, Ergonomic supports, as you can see there, that we talked about earlier in terms of posture. You will see there are some orthopedic supports that are there to help maintain a good posture and help keep a good spine. We also do spine scans. This is to assess the amount of movement or energy that it takes for a certain segment to move. Sometimes you might find that there's too much effort that is put in order to move a joint, which is indicated there in the red. Most of the time is the area that you would find that it has a misalignment, and there's a little movement but a lot of effort. And as you can see there, there's a +1, +2, and +3. That would indicate the severity in which there's more energy loss there. So it's very important that you come for a scan and see how your spine is doing, which areas might be having misalignments and muscle spasms and a lack of movement, inflexibility. Same here, same notion. And thank you so much. Love your spine.
Thank you. Thank you so much, Dr. Petty and Dr. Dion. So, thank you also for sharing the details of how we are able to reach you. I am one of your patients. Just as I was sharing in the morning, I have experienced some of the symptoms that you're sharing, and I think it's one of the things that, as office workers, we tend to forget to move around up and until our body pulls an quick one on us and decides you're going to stop. Just a moment. Sorry about that. So Thank you so much. I'm just going to go straight into the questions that have been asked. So the one of the very first questions we received was talk about the remedy for snoring while sleeping.
Okay, thank you, Mobi. Snoring is usually because there's a blockage of the airway when you are sleeping, especially if you sleep on your back and face up straight, the airway gets a bit blocked. So the best way is to sleep on your side, where you have your neck supported by a nice pillow and the head sleeps on the shallow end of the pillow. That way you keep your airway very open. So you breathe in with no blockage on the way until to the lungs. But if you even in that position, you put your head forwards, that means you block the airway again. So the best thing is to use a very good orthopedic pillow where it will maintain the curvature or the posture of your neck, always opening the airway inside. Otherwise, when you find so much snoring, it's mostly the position you have taken when sleeping. If it's a poor one, the only thing is you snore. But if you put the airway, always airway clean, you won't have that bad snoring. That's part of the remedy. Although there are other medical issues which can be described by medical doctors. Thank you.
Thank you. Thank you so much for shedding light on what exactly causes snoring. Thank you so much. And another question that has been asked is just give me a moment so I can share it. What is the main difference between chiropractic care and physiotherapy?
Okay, I believe also our talk has covered a bit of that. Chiropractic focuses on misalignment of joints, all the joints in the body. And then physiotherapy focuses on the muscles, tendons, and ligaments, which is the soft tissue that is overlying those joints. That's why you find that chiropractic works so well with physiotherapy because in the body they work together.
Thank you. Thank you for sharing that. And I think in a way you have answered the next question on how can chiropractic and physiotherapy treatments complement each other.
Yes, definitely. Like I said, they work hand in hand simply because the muscles work hand in hand with the joints.
Thank you. Thank you so much for sharing that. Can chiropractic or physiotherapy help with chronic pain management?
Definitely, yes. We've had patients that have arthritis. We've had patients that have had pain for a very long time. And because now we are helping in terms of dealing with the pain from the nerve perspective, from the musculoskeletal perspective, from the muscle perspective, we help to manage the pain, depending on, of course, what is causing that chronic pain.
Okay. Thank you. Thank you for sharing that. And I can attest to this actually. A couple of sessions of physiotherapy really, really helped with the back pain that brought me to physiotherapy. Another
That,
question.
mhm.
How do you tailor treatment for different age groups, such as children and seniors?
Obviously, we take a full examination. Whether you're coming for physio or chiropractic, it's important to take full examination and be able to see what is the problem, then design the treatment, the course of treatment uh, due to how the person has presented and what is going on with the patient. So we tailor it in that way. We look at the age, we look at the ability in which we can be able to intervene. Each case is taken separately and uniquely. That's why we do a thorough consultation, and then we do examination and then treatment.
To add to that, Mombi,
Mhm.
the children usually get these defects either through trauma or congenital. So the treatment when you are dealing with the seniors, it is something like almost chronic or sudden of the same nature. So the effect is only that you look at the child, what you need to do to the tissues of a child compared it to somebody who is quite senior. So it's for you to nature the condition according to the age. It's otherwise the same principles are applied when you are treating the two groups.
Okay, thank you. Thank you for sharing that. Next one. For those of us who love the gym, how frequently do you recommend a chiropractic or physiotherapy session?
Okay, there are patients that we see on a monthly basis, and depending on how often and how intense their gym sessions are, the kind of issues that they come with also give us the amount of frequency that they need to come in for. But I would recommend, if you're not even having any pain, I would recommend that you come on a monthly basis or even a 2 months basis. But otherwise, most of the time we see them frequently.
How? Sorry, how many times in a month did you say?
Once a month.
Hmm.
Mm.
Okay. All right. That's
Well,
a good
that's for someone who's feeling well and not having any challenges. But for
Mm,
someone who's coming in and we've assessed them, we've seen what kind of problems they have, then we can recommend, depending on what we have found in that initial session, how many sessions we need to see them until they are well, and obviously also recommend on um, the type of exercises to avoid or the type of exercises to do in order to help the issue that they might be having.
okay. Thank you. Thank you for sharing that. What should a new patient expect during their first visit?
When you come to visit us for the first time, I'm sure you have so much history about your condition. So what we would expect you for first is to get your history. When you
Mhm.
mean history, is the history of what has been happening to you since you had the condition. Two, what have you done about that situation? Then we shall understand what you have done, either medically, x-rays, or other things. This problem you have, is it having anybody else in the family? So that we understand whether it is due to your nature of work or it is a congenital thing. The
Mhm.
other thing is that whenever you go for whatever you have been trying to improve your condition, how does it go? Does it get worse or it comes and goes? That way we shall be able to get the whole history. After we get the history of your condition, we do what we call physical examination. That is the mobility of all the joints Dr. Peteka is talking about, from the neck to your toes. Then we check on your muscular. Is there any wastage or tension or even stiffness of any of your muscles of the whole body, starting from the neck to the feet? If that we are finished with that, the mobility of your joints, whether there are some joints you can't go to full range of motion, we look at it, we call it joint range of motion. After that, then we do what we call, the one she said is scanning of your spine muscles to be able to understand which side is more tensed than the other, so that there is imbalance causing some sort of curving of your spine to one side. So with that, we shall explain to you what we have found out, and we give you a plan of what we can be able to help you to go back to your almost nearer as normal as to what you used to be before.
Thank you. Thank you so much, Dr. Dion. And that brings us to the end of our session for today. Thank you so much for making the time and sharing all this knowledge. Um, and thank you also for sharing your contact details for those of us who are joining online. Thank you so much for making the time. For those who are going to catch the recording later on, thank you for listening through to the very end. That said, have a good evening. We will see you next week when we're discussing strategic communication. Bye, everyone.
Bye.
Bye.